I am muted. That was welcome, everyone. Hello. It's been a little while, so just getting right back into the swing of things with Zoom. Welcome to yet another Roswell Park Ask the Experts webinar. Like I said, it's been a little while, but we're back, and today we're here to discuss a topic that is on many of your minds, and that is coping with cancer, COVID-19, and the holiday season, as we're just 2 short weeks away from really things getting into the swing of things. And I'm Rebecca Vogt. I'm the media relations specialist here at Roswell Park Comprehensive Cancer Center in Buffalo, New York. Now, normally we know that the holidays are a time of joy and gathering with your family, but this year it's been far from normal. We all know that. There have been so many different holidays coming up in the next couple of months across a variety of cultures. So we want to be sure to share advice and recommendations to help everyone. Coping with cancer during the holiday season can be tough enough on families, but now you're going to add in COVID-19 on top of everything else, and the stress factors can rise even more. So we are here to help you as much as possible and hopefully share some ideas for a safe, healthy, and happy holiday season. And speaking of happy, I was totally going to wear an ugly Christmas sweater today, but sort of technical difficulties is not allowing me to do that. So blue it is, but I am wearing some nice bow earrings just to be a little bit festive. Now on to our panelists. I am so fortunate to be joined today by Roswell Park's Director of Infection Control and Prevention, Dr. Catherine Mullen, and also by Dr. Jennifer Heidman, a medical psychologist here at Roswell. Both of you have been on a number of our webinars so far, but for some of the people in the audience that have not tuned in yet, can each of you guys share a little bit about yourselves? And Dr. Mullen, we can start with you.
Sure. Hi, everyone. I am Kate Mullen. I am the Director of Infection Control here at Roswell Park. I'm also an infectious disease physician. So I spend part of my time seeing patients who have infections in the hospital, a variety of different reasons. And then in my free time here at Roswell Park, I spend a lot of time thinking about how to make this the safest environment possible. So thanks for having me, Rebecca.
Fantastic. Dr. Heidman, on to you.
Hi, I'm Jennifer, I'm a psychologist here, and I work with patients kind of from day of diagnosis all the way through cancer treatment. And I also doing some research projects on incorporating mindfulness with breast cancer patients.
Great. All great. Thank you for the intros. We do have a lot to discuss, so I think we're going to jump right into it. We have a ton of pre-submitted questions to go off of at first, but of course, this is an open forum and you can submit questions at any time utilizing that chat feature down below, the little bubble. And just make sure to check the anonymous option if you don't want your name to appear, but make sure you send it to all panelists and we will get it. We'll try to get to as many questions as we can within the next 45. Well, actually, we have about an hour, so 45 to an hour. But if your question is not answered, don't hesitate to ask your physician or also call 1-800-ROSWELL. This webinar is also going to be recorded, so thankfully you're going to be able to check it out later or pass it along to friends and family members who might not have been able to tune in this afternoon. So that being said, let's kind of kick it off. With the big old question. We got Thanksgiving right around the corner. I usually host Thanksgiving for my extended family. Can I even do that this year?
So I guess that's directed maybe more at me, and then Jennifer can follow up with you, or Dr. Heidman can follow up with some positive news. But I think that holidays are going to have to be different this year, and I think that is sad for a lot of people, including myself. I usually, like you, Rebecca, I love holidays. It reminds all the good smells and the seeing people you haven't seen for a long time who you really love and you want to be with. But this year, unfortunately, given the level of COVID-19 in the community and the fact that people can transmit disease days before they even get sick, and so you really can't. It's very difficult to create a situation where you have multiple people from multiple different environments intermingling in a safe way. I think that we're really going to have to talk about having smaller group gatherings in the local community for this holiday season. So traveling far distances to see family or having big get-togethers where there are a lot of people in a small space is really not advised. Again, not because I don't completely empathize as a fellow human being that that's exactly what I would want to do too. But it's just not, there's no real way to make that safe this year.
So I'm going to jump around a little bit because there's some questions that do kind of lend itself to, what you just talked about. There's a lot of the flying versus driving. And I know we have some, New York State guidelines that need to be followed if you're coming in from out of state. So we have this one question asking though, if family wants to come from other states from the holiday state, it is very close to it's your mother-in-law, your father-in-law. I mean, if they drive but don't fly and quarantine when they arrive, what sort of, protocol there? Is that okay?
Well, I mean, there's state guidance on this front, and I think the state guidance actually was changed in part because there was the recognition that some people are going to have to travel, sometimes for essential things, particularly at holidays. And, I think that, while we can give guidance about the safest way to do things, that some people will still travel. And so in terms of coming to New York State, this is very sort of clearly defined by the state. This is not sort of Roswell rules or my personal rules, but the state rules as of now are that you have to get tested within 72 hours prior to getting to the state, and then have to have another test day 4. And until that result is back, you have to remain in quarantine. So you're not able to leave wherever you landed in the state.
Now, say we are talking in-state, and we're talking, mom lives down the street from you, because it's already been dictated. If you come out of state, you have to have your COVID test. But like I said, if you have a family member in New York State that's coming over, or it could just be the neighbor across the street, should I make sure that all of these guests get COVID tests before coming over for the holidays?
I think the name of the game is keeping the fewest sort of risk points as possible. So if you live down the street from your good family friends and your kids are in their classes at school and you're in the same little cohort, that's not going to increase your risk dramatically over what your sort of typical day-to-day risk is. And people have different comfort zones about and knowledge points of you should sort of get a sense of the people who are coming into your bubble. What have their decisions been like within the last 14 days? And again, very personal. So, people may, for a variety of reasons, make different decisions, but everyone has different job roles and interactions, and having a sense of those can sort of inform some of your decisions too. But having everyone get tested prior to Thanksgiving, I do not advise. Again, I think the safest decision is to really not travel and stay in your local community. If we have a run on testing for everyone who's asymptomatic, the worry is that we will be delaying and taking up resources from people that we really need to focus on testing and then contact tracing to minimize the subsequent risk for, the rest of the winter. We started out, this area of the country, we've actually done a really good job the last several months, but over the last couple of weeks, the last 3 to 4 weeks, we've seen a pretty dramatic uptick. The number of people who are currently hospitalized in Erie County is about double that it was 2 weeks ago. These are indicators of the fact that we definitely have a much higher circulating density of virus, with the knowledge that a very small percentage of people who get COVID-19 are actually going to need to be hospitalized. So for any one of those people who's hospitalized, there are, another 9 people, running around who are minimally symptomatic. So, having everyone get tested before Thanksgiving would potentially be a public health issue from missing out or, using resources up from people who are actually sick.
Absolutely. Now I've got one I kind of need to combine into a couple of things because it kind of opens its door to, you are welcoming someone from out of state. You're welcoming, say a daughter and children in, and they've got tested as per New York State guidelines. Once they kind of even cross that threshold, I mean, can they even come in the house? Can they use the bathroom? Should they be wearing a mask, especially if you have a cancer patient in the home?
Mm-hmm. So obviously, outdoor things are much safer than indoor things. That sort of general guidance has not changed. I think anything, if people want to have sort of like a backyard fire pit and can make sort of a different Thanksgiving this year. And even though, because we always run the risk, we are in Western New York. We are not in Southern Georgia where it may be 65 degrees. It also could be cold here, and so we realize that this guidance is weather dependent and may look a little different depending on where you are. But outdoor things always preferable. Mask wearing in inside spaces when you're in close contact is really the gold standard. If both people are wearing masks, there's very minimal risk of transferring virus from person to person. Again, because people can be symptomatic people can be shedding virus and contagious for several days before they would have any symptoms. So, at the end of the day, the message we really want to have is that, people don't spread virus on purpose. Like, people really care about their loved ones. They really want to be with the people they love. And that's totally normal. And most of the time when this gets spread, it's because people had no idea that they were putting their family members at risk. So this is why our general guidance right now is to not mix bubbles as much for holidays, because you unknowingly could put someone you really love at risk.
Thank you for that. We'll kind of jump around a little bit, get Dr. Heidman in on a couple of questions. So, we have a family who's taking the route of kind of going as we're talking right now through Zoom. They're doing Zoom for the holidays. And unfortunately, the person who is writing this in, it says, "It's put me into a depression. I cry almost every day thinking about how different things are this year. What can I do to snap out of it? I feel like I'm being petty."
Right. That's something that I'm hearing pretty often. And I think we just really need to acknowledge just what an unprecedented time of year this is, right? Or what an unprecedented year this is of just such isolation and tension in this country that we're really dealing with many, many, many stressors right now. And so I think the holidays this year would have really been a very nice time to kind of let go and connect again. And so I think it's so wildly unfortunate that things are coming together in such a way that we probably won't be able to do that normally. But I think just acknowledging that is really important for people. And, I think the biggest thing is, as Dr. Mullins really kind of laying out the guidelines, is to be really clear on what the guidelines are, what your risk level is, right? Is somebody in active cancer treatment? Does somebody have other health conditions? And then really communicate quite clearly with one another. But it's nice to hear that people are getting creative, right? I think doing things like a Zoom Thanksgiving dinner is really a great way to go, because it doesn't have to be all or nothing. It doesn't have to be either we're in person, 25 people at the table, just like every single year, or forget it, I'll just see you next year, right? We have to get creative. We have to think outside the box this year. And you know what? We've been doing this for 7-8 months, right? We've had to get used to this for a long, long time. So luckily, we've had some experience with pivoting when it's time to pivot. This is just a really hard time to do it. But I think the biggest thing is to remember why the holidays are important to us in the first place, right? What is it that we accomplish with holidays? We connect, we give thanks, we show gratitude to one another with gift giving, and we sort of pause and reflect. And so I think that these are things that we can still do. It's going to feel a little different. It's not going to have the same, warmth and in-person feel, but we really can do all of those same rituals and those same tasks over Zoom, with a phone call, with FaceTime, with a letter, right? And so I think that's really kind of getting back to what COVID has made us do so much, getting back to basics, right? Of how do we connect to one another at a time when it's a little bit different.
And maybe one added benefit is that you don't have to cook for 25 people too. I mean, you just pop a small bird in the oven and there you go. And you can have all the stuffing to yourself, which one of my favorite things. And I like to hog it a little bit. So if there's any sort of silver lining in that, that could be that more food for you if you want.
I think it's important to reframe that, right? I think we can see this as a time of loss and loneliness and all the things we don't have. And we can also reframe it as things are going to be simpler this year. Let's take the pressure off of doing everything so perfectly and getting all the perfect gifts and perfect food, and right, like maybe this year could just be a little bit simpler, which could actually be quite nice.
Absolutely. And to your point about, like something handmade and like gifting and and letter too. I mean, we're so used to, just chatting back and forth digitally. Getting something that's just nicely handwritten from a friend, a family member. I've always appreciated just sort of those like thoughtful handmade gifts over, just something that, click okay on Amazon personally. So and that, yeah, if you're really trying to tie back to what matters, it's, putting that meaning into, your gift giving this season. So another sort of switching point though, got some questions about stress and being on edge and panicky. Two that kind of blend into each other is, someone who might have finished treatment about a year ago, still scared to do things like go to the grocery store, the stress of the holidays, it's, piling up too much to manage. And then someone else who is undergoing chemo soon and it doesn't help things. Is it normal to be so on edge and panicky, especially this time of year?
Yes, I think is the simple answer. Is it pleasant? No. Is it sort of typical and normal at this time of year, and then with everything going on to feel quite anxious and worried? Absolutely. So I think that's part of understanding is this is quite normal. Everybody's on edge, right? To some degree, but what can we do about that? I think is really what people are asking, and how can I take back a little bit of control? And I think that's really what this is getting at. This has been such a time of uncertainty and loss of control and loss of expectations, which is really what makes people tick, right? We want to know what's coming. We want to know when will this end, and we haven't gotten any clue about that yet. So this is where we can really start to say, what can I take control of? I can control how much I expose myself. I can control how well I take care of my body. I can control how well I stay connected. And so I talk a lot about this with patients, down to the detail of, we're not going to wait until you're feeling really, really down or until you're having panic attacks about going to the grocery store. Let's make a plan now about, what are you going to do on a weekly basis to move your body, even when it's really cold outside? What are you going to do to get your groceries when you are starting chemo and you might not want to go to the grocery store? Who's on your list of go-to people? Who are the 2 or 3 people that you can count on for various needs, right? Practical needs, emotional needs. Write their names down with their numbers, and maybe really make a plan that we're gonna keep track of each other through this winter and check in once or twice a week. But really getting down to a very detailed plan of sort of like a mental health plan and a physical health plan for this winter, I think is super important for people to bring those stress levels down a little bit and to have a sense that they can exert a little bit of control over a really chaotic situation.
I can tell you, I've definitely been like way more discombobulated than normal. So you're right about making a list, because I really like have to keep on task. And like, once I can like check something off, it's really, it's a breath of fresh air, and just knowing that like it's done, it's off the list. And even as you said, like, designating someone to help you pick up some things, especially if you're like immunocompromised. I mean, it is a season of giving as too. So, if someone wants to give back to you, I think that's the least that someone can do at this point, to help you out, especially if you have to stay home. I'm going to switch on back to just a few questions to Dr. Mullen. One that actually came in, we talked about people that are coming to New York, and maybe some people coming, from out of state, or even, like I said, the neighbor down the street. But someone asking about if they're kind of at the position where they're going to be traveling by air themselves, flying out somewhere else out of state, just best practices, especially if the one airline that they are on actually says that they're blocking off the middle seat, which I know some other airlines, not so much. They're starting to go back to filling the entire plane. But any best practices, Dr. Mullen, for someone who has to fly?
So, I mean, it sounds like the airlines have done a pretty good job trying to making sure that everyone is masked on the airlines. I think that this would be the time where I would definitely I would not be wearing sort of a cloth mask, but definitely wearing one of the sort of the paper 3-ply masks that do a better job of filtration. You can buy them off Amazon. They're not super expensive, but this isn't the time to wear like a a festive mask, you know, you really want some protection from it. And keep your mask on the whole time. You know, just basic things like minimizing interactions, direct flights, you know, you carry on your luggage so you're not stuck at baggage claim. Just these, if you think about your process as minimizing your interactions with others, that is the safest way to go. And so you mentioned best practices. Rebecca, I'm getting you to talk. We're talking an infection control talk here. So if you walk through your trip and you think about how you can minimize interactions with people with whom you have no control over what they do, where they've been, whatnot, that inherently is unknown risk, right? Could be very minimal risk. It could be that all those people have been in their house working remotely, getting their groceries delivered for months, or it could be people who are very, very high risk. You have no idea, but minimizing those things will make it as safe as possible. Again, where it's safer, not safe, you know, and that's how you have to think about it, risk minimization. And I think dovetailing on what Dr. Heidemann was mentioning in terms of decreasing anxiety, having a plan going into that to, you know, sort of structure how you're minimizing things is the best plan. I would not take my personal recommendations are do not take your mask off. You know, obviously, if you need to take medications or you need to do something where you need water or something like that, you should always do what you need to do medically, because that is more important than any risk of getting something else. But that being said, if you don't need to eat or drink on flights, I would keep your mask on the whole time and not have layovers, things like that. Those are sort of bread and butter ways to minimize those interactions.
And now one thing, I know you had mentioned sort of how you love the smells and the sights of Christmas, Dr. Mullen. One question's talking about, you know, can I still go to a Christmas tree farm and get my tree since it's outside? Or can we go to a Santa visit? I know if we can find one. I mean, I know a lot of the malls are doing the precaution where you can't even sit on Santa's lap this year, the whole 9 yards. So just wondering where we go when we're talking about something that's fully outside and pretty, you know, physically, socially distanced from people, and then maybe something that's like in a mall.
Sure. I mean, I know for my family, we are going to be doing all of the things like the outdoor fun Christmassy things, because we're not going to have the usual holiday get-togethers of the constant, you know, festive craziness bouncing from one dense group setting to another. So really trying to emphasize, and, you know, again, as Dr. Heidemann mentioned, what's special about this period of time that we may never have again, you know, taking treks through snowy woods and cutting down your own Christmas tree and things like that. Those are definitely ways to have fun and have new experiences and make this time of year memorable, even in this very, you know, psychologically difficult time for everyone. So I would very much recommend, you know, I am someone who definitely gets joy out of planning and having things to look forward to. And I think that that's a pretty normal thing. And so having things like on, you know, a upcoming to-do list that incorporate safe activities, which are outside, you know, which, I mean, outside being the safest sort of domain, you know, is a great way to do that. Just do things that you wouldn't have thought you would do. Rent snowshoes, do things that that any other year you probably would have other options and it wouldn't be your first pick. But I think that will keep people going through a difficult time.
Fantastic. This could actually be a question for either one of you to really tackle, but my family doesn't understand my fear of COVID because they're not immunocompromised. How can I better explain this to them in a way that they understand? I'm sure there's sort of an infection control way of coming at it, but also I know, Dr. Heidemann, I'm sure you have talked to many patients about or how to deal with this with their families as well. So I'll leave it to either of you.
I guess I'll start and then let Dr. Heidemann sort of give her perspective. You know, I think it's difficult to, you know, especially when you're physically separated from friends and family, who may not have lived through your medical experience with you, and how challenging it can be, and also have that real world sort of in your face knowledge of the risks that come with contagious diseases that may be worse for immunocompromised patients than others. You know, I do want to add in that I think that obviously, if you're immunocompromised, we very much recommend, not just for COVID, but in general for other circulating respiratory viruses, that, doing these things that minimize your risk is definitely in your best interest. But I did want to take this opportunity to alleviate some nerves that we really have not seen. There's a certain subset of patients who do have medical conditions, blood pressure issues, things like that, that do seem higher risk for getting severe COVID. But we really have not seen that borne out in our cancer population in the same way. Now, that does not mean that certain cancer patients may not have a very severe case of COVID. And it's very reasonable to be very protective in the setting of this pandemic. But, if and when you do somehow get exposed, I wanted to take the opportunity to say this does not mean that you're going to get the worst case of COVID and that you're going to be in the ICU and whatnot. So it's still very likely that you would have a mild case. That being said, we want to minimize any risk that you have. And I think that, explaining to family and friends that you really want to be around to celebrate Christmas with them next year, and that's really your priority, is I think a good way to frame it.
Right. I think these are difficult conversations. I think patients who are going through cancer treatment feel like this often, even without COVID, right? That people really just don't get it and they don't understand what this world is like. And so I just encourage patients to talk with family members, ones that they might have been seeing over the holidays, with an open mind, right? To try to go into that conversation, as not defensive as you can, right? Without your preconceived notions of what they're thinking. But just explain pretty matter of fact, in a matter of fact way of, this is why I'm not doing this. And I think that's a great way to frame it. Like Dr. Mullen just said, that we're going to have to sacrifice, some things this year so that we can do this next year. And hopefully with news of vaccines coming, who knows, maybe that can help people to feel a little bit more like, okay, we might actually see some relief here sometime soon. And so that makes the end game feel not quite so far away. But I encourage patients all the time to just come up with your sort of elevator talk, right? Your 2 to 3 lines of why this is important to you, why this is what you're going to be doing, and kind of leave the emotion out of it as much as you can. And that's hard, but sort of just, again, like matter of fact, this is why I'm doing this, and this is what I'll be doing, and see you next year.
If you stand up for yourself, really.
Yeah.
For sure. We've got a dinner question that came in. If you're having a holiday family dinner with people from different households, does it help to space out seating by skipping every other place, like a 50% capacity at the table?
Yes, it does. So again, spacing helps. Eating, and that's one of the reasons that holidays usually involve a lot of food for a lot of families. I don't want to say all families, but most families, it involves a lot of food. And eating, obviously, because people are inherently unmasked to eat, is a high, and usually sitting at a table where they're close together, is what we consider a high risk exposure. And so thus, I think from a sort of a public health concern, why it's not as much the traveling that actually poses the risk in of itself. It's more of the traveling, mixing risk, and then being in high risk exposure situations over a Thanksgiving dinner, a Christmas dinner, or something like that. So any way you can decrease density is helpful. So we know that, yes, you would ideally be 6 feet apart from someone, but 3 feet apart is better than 2 feet apart. 5 feet apart is better than, 4 feet apart. So you can just use a general guideline. Again, you're never going to be able to take away 100% of the risk, but these ways that you can simply risk modify can be very helpful. So I think one of the things that's been, I think in reflection, when in a post-COVID era, we can go back and reflect on things we could have messaged better. And one of those things, I think, is the difference between social distancing and physical distancing. So social distancing means and a lot of cancer patients or people who've gone through cancer therapy know how to do this. Social distancing is the same thing you do if you have a new little baby and you're saying, oh, we're not going, to the grocery store right now. We're not having tons of visitors in our home. That's a very sort of inherent concept for most people that they understand. That's, keeping your bubble smaller. That's social distancing. Physical distancing is what you're talking about, exactly, where you're space modifying to make the physical distance between two people more, and thus decreasing the risk. And so I see all the time in the media and lots of discussion about, oh, you need to be socially distancing. That, yes, we should be socially distancing and keeping bubbles small, because that means that even if someone in your bubble gets sick, it's just that bubble that's affected, as opposed to lots of people as the bubbles gets bigger. But physical distancing plus social distancing can be very helpful in decreasing risk, for sure.
And heck, if the weather keeps up around here and you can put the table outside and make it 50%, golden.
Yes. I mean, even to the point where we've talked about things like, doing things like, dressing up like having sort of a winter dinner and dressing up in like complete garb from head to toe, and doing silly things like having like a tea party outside and things like that. But you can tell I have 4 little girls that we talk about tea parties, but I think outside space, definitely the best situation.
So a couple of questions are coming in about individuals who live alone. One saying that, like, all I keep hearing is to celebrate with your household, but I'm by myself. I feel like no one's recognizing sort of the mental health aspect of it. And another one is a cancer patient living alone. I know the safest option would be for me to not travel. This is sort of breaking my heart. Cancer has made me realize what matters in life, and that's time with family. And then, for the other person who's living alone, I mean, it's definitely like a heavy burden to hold on someone's shoulders right now. Again, this could come from either one of you, but I mean, Dr. Hyman, I don't know if you would like to tackle that first. How are we kind of addressing the individuals who don't have like legitimately immediate family in their household?
I missed the very end of what you said, who don't have.
Just saying, like, we don't have, like, people who just don't have immediate family in their households. I mean,
Right.
what's sort of the suggestion, if they are craving sort of that social.
Right. Yeah, I think that's a tough one. And I think that I'm working with a lot of patients right now who are living alone and are really, really struggling emotionally right now. This has been months and months and months of isolation. And again, there's no time like the holidays for it's our default that you're going to be around other people. So, I think this is a choice point for them. Do they decide that I will get together with those few people who are doing it distant and are doing it outside? Is there any way to do that? Do I take that chance? What's my risk level? Or do I just really kind of say, this year I've got to kind of sacrifice this one? But again, don't make it all or nothing. It's not black or white. You don't have to sit at home and just watch TV all evening and pretend as if the holiday is not happening. Another thing, honestly, that I work with a lot of patients on is how can you, when you're feeling really distressed, actually give to others in a way that it kind of distracts you from your own distress, but it also provides this nice sense of connection in a different way, right? So I have a lot of people who, even though they're feeling lonely themselves, to combat that, they reach out and try to help others. So there's ways this year, I'm sure, to get involved in, preparing meals and delivering them to people who really, really can't get out of their homes, who are really in a situation that they're incredibly isolated with no options. So I hear that plenty from people, that when I'm really starting to feel low and I don't, I'm feeling disconnected, I'm going to put that energy into reaching out to help others, because I think that's a wonderful way to kind of get out of our own situation a little bit. And then you connect, right? And that's what all these times are about, is connection. And that can be down to something as small as, I'll say to people who are just craving, we can't give people hugs and we can't, hold our grandchildren. And that's awful. We're creatures who love, who feel connected by touch. But I think it's still really important to, even though you can't hug somebody over the holiday, to make eye contact, to maybe there's an elbow bump, but maybe really just continue to make eye contact when you pass people on the street, when you do go to the store, to really look at people, right? Because we connect a lot through visual cues. And I think, it's really going to be a lot of little things like this that help us to feel connected this year, not alone. And then I think we've all kind of given out ideas of maybe some of that money that we would have put towards holiday gifts or the big holiday dinners, can we maybe put that toward making our environment maybe feel a little bit cozier? Maybe we put up a lot of lights inside the house. Maybe we decorate in a different way this year, right? We look forward to little things in ways that we didn't before. You know, all of a sudden a new TV show coming out is like huge in a way that it wasn't a year ago, right? And I think we have to kind of change our perspective to continue to get excited about things, because the holidays are different. You know, taking a trip this winter might not happen. We might not be going to a nice warm climate like we usually would. So what can we do instead? Can we take a cooking class online? Can we learn to do some new sewing technique? Can we learn a new craft from a class online because we didn't spend quite the same on the holidays? You know, I think this is, again, we're all talking about how to get creative, but to really pay attention to how to reach out and be connected to others is what it comes down to for me.
100%. So you are now giving me the green light to buy as many Christmas lights as possible for my house and make it look like Griswold's, right? So just so we're all on the same page here, whatever floats your boat. We have a couple questions, Dr. Mullen, about masking. So while you're perfecting your smize behind the mask, two things that have come through is someone who had a stem cell transplant wore an N95 mask. Do you think any other mask truly protects you? And then also someone who is flying, wondering if, a face shield or goggles is also a best practice.
Sure. So, we do know there's minimal risk, like in the hospital, if we are interacting with someone who has COVID-19, we use face shield, N95, whatnot, that will maximally protect you. Do you need to do that? I wouldn't say you have to do that, but that is the maximal protection for sure. The regular, sort of what we refer to as procedure masks, the paper masks, the 3-ply ones, which I mentioned you can access at a drugstore or Amazon now, but were in very short supply, like in March and April of this year. Those actually protect you very well. They protect about like 95% of what an N95 does. So yes, N95 is the gold standard, and it gives you that last 5% of maximal protection against aerosols for COVID-19 and other things such as tuberculosis or measles. But the paper masks are very protective, and so that's what I wear every day. I don't, that's just for my baseline, both in the hospital, but then also outside of the hospital as well. And I do recommend that for patients in and out, in the community as well when you do venture out. So I think that if you feel better with that maximal protection, then you should do that. If that's going to make you feel safe. Some of this too is that everybody does have different comfort levels and a different acceptance of risk. I think knowledge is power. Being armed with knowledge of what type of risk you're accepting is very empowering. And just to dovetail on the prior question, I did want to add that, for people that live alone and, they're asking, can I go over and eat with my, great aunt and uncle who also don't really leave the house? Some in a physical interaction and whatnot during the holiday season, it's not all or nothing. And I would say that some of that interaction you could really define as psychologically essential. So I think you need to treat your personal situation, which none of us are in, right? Every single person has their own nuanced individual situation that comes with its own joy, its own baggage, and sort of decide, yes, if you do anything with any other human, you're accepting some level of risk, but is that a level of risk that you're willing to accept? For some people, eating Thanksgiving dinner with 2 other people that are also low risk people for having COVID, that is psychologically essential to them. And I would actually say, I would recommend that people do that. It's going to be it's really a marathon, and I think that we're seeing with spread in the community, we're seeing that people have really bad COVID fatigue and are making poor decisions. Like, we're not talking about risk modification, we're taking like actually really poor decisions because they are tired. And I think, again, we're all tired. We would all love to be able to like hug our parents and do things like, just do normal physical and social interaction things. So again, while we're going to be in this risk modified environment, and I'm very much recommending that, there are some situations where you could really say that as, you know, an adult human, you're making the decision that you're willing to take on a little bit of risk and have an interaction with someone that you really feel like is essential. I think that that's very, very valid. So I just wanted to throw that out there.
No, very well said. Thank you for, you know, adding on to what Dr. Heidman was saying. Kind of circling back to interactions, what about, you know, young children with older adults? Any sort of specific precautions there? You know, should the little ones be masked? Should the old ones be masked? Like what sort of, what
Yeah.
should
So, I mean, again, I'm always going to say masking is the safest and whatnot, but I will say kids under the age of 10 are not good at spreading COVID. And so despite what there's been a lot of crazy inflammatory headlines in the media. And to be honest with you, sometimes I read these things and I think, God, if I didn't know the actual studies that were being cherry picked and whatnot, I would be really scared. Like I would be really, I wouldn't know what to think, because you read one thing and it sends one message and you read another thing that says a completely different message. And I think we know that kids under the age of 10 are not good at spreading disease. Now, can they? They can, but they're not as good as kids over the age of 10. So if you have a 1-year-old baby who has been at home while their parents are working remotely, that baby is not going to be, you know, a big risk of spread to you. And so part of the difficulty with some of these COVID-19 discussions has been it's very nuanced, and it can be hard to understand that all of these pieces that add to risk are very, very, very nuanced. But in general, kids under the age of 10, very, very bad at spreading COVID. So even if they get COVID, they can get COVID and have COVID, right? Usually from an adult, they do not pass that along well. And they are very, they're very unlikely to get sick themselves well. And we know this from household studies and school studies that are out now. And so if you're in it's kind of a different story when you're talking about teenagers or people in their young 20s who are inherently a little, shall we say, risk averse, not risk averse, not the opposite of risk averse, not risk averse, not necessarily, risk modifying, ideally. And they can get disease and spread disease more. It's a different situation, but I know that there's a lot of confusion about particularly little kids. Now, the one caveat I should say is that little kids are amazing at spreading every other type of virus. So thus the initial concern about could kids be sources of spread? Could school be sources of spread? We have not seen that borne out with COVID. Very different situation for things like flu, RSV, and those really do pose much higher risk in immunocompromised patients. So inherently, a lot of the COVID precautions that we've gone about as a society the last several months are protective against also spreading some of those respiratory illnesses. So this would be my general guidance for any year, is that having that social distancing, right, of doing things with smaller groups, fewer interactions. Preschoolers, very unlikely to give you COVID. Preschoolers, very likely to give you RSV. So, I mean, it's a little bit, you have to sort of make decisions about this, but do not hug your 1-year-old grandchild because you're afraid of COVID. If you are afraid of other respiratory viruses, that's a little bit of a different story.
And that's something, though, that every year going into the holidays, even in a pandemic year, that people, should be aware of too.
Exactly.
Yeah.
So these are, to be honest with you, I think some of the takeaways that we should get from COVID are that, inherently our cancer population has been doing a lot of what we would consider best practices to begin with. So there aren't, people had naturally already sort of thought through, how should this be risk modified? Who do I really want at that Thanksgiving dinner table? And how can I express to them that if they're coming to that dinner table, that I really need to make sure that they are also knowing that they're potentially bringing with them exposures to whatever they've been exposed to in the last several days or week. So yes, I think that take with you things that you would have thought in 2019, and then superimpose, COVID for whatever nuanced situation, is involved with your personal, individual situation.
Absolutely. So one kind of question, it's sort of almost like a morality question, if you will. you have people inviting people left and right to come over, getting the invites and, and also inviting people from out of state to join as well. Some people are politely declining these invites. And as I think Dr. Heitman said, standing up and saying, no, I'm this year, I'm, taking charge of my health and I'm not going to do this. The point being though, why are people taking the chance of transmission? Like what sort of is, going on and running through people's heads thinking that, this might be okay this year?
I mean, I think that's a tricky topic, right? That's a whole topic of, risk perception and risk aversion. And I think Dr. Mullen said it great just a few minutes ago of people are constantly weighing out the psychological toll versus the physical toll of this illness, right? So I think people will be willing to take risks when they feel that it's worth it to them. And this is why, like she said, these are just discussions are so hard because people want to be told this is what you need to do. And it's just, we can't say that for the whole population. We can't even say it for whole chunks of the population necessarily. So, I think we can't ever know what's worth it to somebody else. And to them, they might say, I haven't seen my family in 2 years. I want to live my life as if, we don't have, it's precious and we don't know what's around the corner. So I'm going to take the risk this year and see them. And we're going to be smart about it and we're going to take precautions, but I'm not going to deny myself what makes my life feel complete, which is my family. I can appreciate that. Right. So I think it's like she, like we're saying, inform yourself, know your guidelines, talk to your physician about maybe what your, immune system is like. And then you have to make your own decisions. I think the biggest thing we can say to people is communicate clearly with one another, come up with a plan. Don't assume that everybody's on the same page, right? Communicate with every single person who is going to be there. Listen, here's the ground rules. We're doing masks, we're doing this, we're doing that. And if you kind of can't agree with that, then you might need to make other plans, right? But just be very clear and open about what your priorities are and what your plans are. But I think accepting that other people will make different decisions than you will, we've been seeing that for months, right?
I did want to just add one thing that these are not just theoretical risks. For example, Canadian Thanksgiving was last month, and Canada has had historically over the last several months very low rates of COVID compared to the United States, and they saw a big spike after family gatherings and whatnot. And so, again, I think I'm a big fan of advocating for not doing the all or nothing approach. So if you cherish being with other people and really feel like that is a essential thing that you cannot be without, great. You've made the decision that you're willing to accept a little bit risk, but don't do the hugely dense, huge dinner you had. Maybe you only do things with 10 people or 8 people as opposed to the typical 25 people or 30 people. So, but I did want to add in, it's these risks we talk about are real risks when we talk about lots of spread throughout the country. So, again, individual decisions, some things are totally essential because, there's also a very legitimate argument to be made that there may be some listeners on here who this is their situation, say, well, that's great for you to say, there's next Christmas, but maybe I don't have a next Christmas. And that's very, very legitimate. And so I just want to validate that. I think we need to, that's why we can give ideal guidance. And for me, I'm, the oldest of 5 kids. I love spending the holidays with my big, loud family. We're not traveling during the holidays, but I'm in a different personal situation than other people are. Other people may say, I know that I'm only probably going to have 1 or 2 Christmases left or 1 or 2 Thanksgivings left. And I want to be with, my grandkids, or I want to be with, my great aunt and uncle, or whatever the personal situation is.
100%, absolutely. So a couple of quick things. I know we're getting very close to end of our time here. A couple of last minute things that are coming in. Are we able to talk a little bit about, college kids that are coming back and they're going to be staying for a little bit longer than just 3 or 4 days, kind of like transitioning them back in, and, especially after there have been so many college campuses that have been just like riddled with COVID cases. And I know a lot of them are doing exit testing before they leave and even quarantining them before they come back, but sort of any sort of best practices there for our college age kids that are coming back home.
I think probably very situational based on where they are. If they have local cases, I know that there are some small schools that literally have had no cases, and they really cloistered off their school and done a really great job about making sure that their, congregate high risk setting has been immune to some of this stuff because of physical barriers, essentially they or policies that they put in place to minimize that. Very different coming from a very cloistered, liberal arts college where there have been no cases versus potentially like a big state university where there are thousands of kids and potentially a lot of recent cases. Those are, so again, nuanced. We wouldn't be able to say a one size fits all approach. I think that they're gonna have to have that exit testing to comply with New York State guidance, right? So regardless of where they are, they will be having having exit testing to come back into the state. And then, also I would just really encourage those of you who have college age kids, have an open and honest conversation with them. Some of you may have college kids who are like super by the book, like, we're only allowed to be with like 6 or 8 other people. And I haven't done, I've only done that. And but none of my friends have been sick, blah, blah. That's a different situation than, having a kid who is in an environment where they don't have a lot of rules. And they're like, listen, I gotta be honest with you. I was at a party that got way too crowded last weekend and I really didn't have control over it. Again, many people are not intending to make bad decisions. It's just, they end up in situations that they didn't predict, and that poses risk. So open and honest conversation, not sort of like a judgmental one. But if you're in a situation where your kid and your kid's fraternity house ended up having 100 kids in one small living room area, that may be the kid where you get the exit testing and then you say, hey, when you get home, you're going to sort of be hanging out in your room and wearing masks, and we may be doing dinners, staggered or whatever for a couple of days until you get that day 4 testing. And then again, you can sort of make a graded approach. We know that there's risk of starting to shed virus anytime in that 14 days, but the majority of people do start shedding between the day 3 and day 7. So by that sort of 7th day, your risk is a lot less. But I think the theme is just encouraging people to be sort of really honest so that they're empowered to make decisions about how to risk modify.
One last thing I want to eke in here is a last minute question about staying in hotels. Thoughts on that?
So for hotels, I think that hotels potentially could be a good way to de-densify situations. Again, if you are traveling to visit a family and they have a small house and you're planning on doing like an outdoor Thanksgiving dinner or something, staying in a hotel is a way to make that safer, as opposed to, our typical extended family thing, which is to shove kids in sleeping bags and just, sleep on couches. And, I know a lot of families do that too. So this would be not a year to pack like sardines into a small cabin. This is a year to potentially, if you're in specific situations, staying in a hotel may be safer. Again, a lot of hotels have really done their best to risk modify themselves so they don't have a lot of interaction with customers. They have, periods of time where rooms are, there's been 100% air exchange and high touch surfaces. They have standards for cleaning and whatnot. We haven't seen outbreaks linked to hotel stays. I don't think that that's a super high risk exposure. And again, for people who have deemed travel to be sort of essential in their situation, it may be a way to risk modify to make their personal situation, tenable or less risky for this.
And before I go into my whole closing spiel, I just wanted to open the floor one more time to both of you. Any last parting thoughts today?
I just think that this is a real opportunity to sort of be kind to ourselves, take the pressure off of ourselves this year, take the pressure off of one another to make this, super perfect and to make it the same as it always is. This is a time to get creative. It's a time to maybe kick back a little bit and loosen up the reins on how it has to be, and just find small ways to feel connected to one another.
I think my advice would probably be pretty similar in terms of, figuring out how you can make the most of this very odd time. I ask my kids this all the time, like, when we look back on this, like, what special thing are you going to think about? Like, oh, wow, that was crazy, but what did we do that was, that was odd that we may not do again? I think that planning is good. Plan to do things that are low risk. I think looking forward to things is very helpful, but also having power over making those decisions to do low risk things that you feel are in your comfort zone, and that can provide you with that sort of sustenance you need to keep going. Planning things out to risk modify as much as possible. So like we were talking about with travel, if you are traveling, minimizing those potentially high risk exposures with people you do not know and you do not know their exposures. And then also really open and honest communication with people who are going to be in your bubble temporarily, or potentially for longer stays, as we mentioned with college kids and whatnot, about what potentially their literal potential baggage they're bringing in terms of an infectious risk. I think all of that will lead to positive interactions and less anxiety, because my sense from talking to a lot of people is that everyone, no matter if they have a history of cancer or immunocompromised or have other medical problems or older age or a high risk category, everyone is very anxious about bringing something to people that they love, or taking on that risk. And so I think that, be armed with the facts of what is more risky than not, and really own your decisions. If you say, you want to have your Thanksgiving dinner of 8, you're saying, I'm accepting that risk. If I get COVID from these 8 people, so I think that people, will take solace in saying, this was a super informed decision on my front. It's not, super crazy risky, but I know that there is some risk, and I am taking on that risk, and I will own that risk. And I feel like that will lead sort of the ability to make it through the holidays, and then beyond, because there's a winter beyond the holidays as well.
Thank you both for all of this. So much information passed around. I, for one, am really excited to see the photos of you, Dr. Mullen, and your girls all bundled up outside with that tea party that you're speaking of, and encouraged by the green light that Dr. Heidemann has given me to over-decorate my house. So all things wonderful there. But we also hope that you guys got, a lot of knowledge out of today's talk. If any of your questions were not answered, we're going to encourage you to reach out again to your primary clinic and also your care team. And a reminder again, the video from today will also be available to view on demand, and a link is going to be sent to your email. So prod everyone that didn't tune in, because they should definitely take a gander. We're also going to invite all of you, a shameless plug here, to check out all of our special plans for Tree of Hope this year at roswellpark.org/Tree of Hope. This year, our event will be a special televised broadcast and a Wreath of Hope contest. That's super new, and that's awesome and great I'm really excited to see what people are going to submit. And although we can't be together in person, hope does unite us this holiday season. So we want you all to mark your calendars for Friday, December 11th. You can light a candle, put your holiday lights on, including all of my excessive lights I'm going to be putting on my house, and spend a cozy evening at home with your family, supporting and honoring those affected by cancer. And again, that website is roswellpark.org/Tree of Hope. And as we wrap up and come to an end today, we want to thank you all again for tuning in and for spending your lunch hour with us. We hope you find as much peace, joy, safety, and comfort as possible this holiday season. We at Roswell Park, we are all here for you. We want you to remember that together, we will absolutely get through this challenging time. Stay safe and have a great day, everyone. Bye.